Late last year, an Italian research team from the University of Siena released their findings into a 10-year study, looking into the effects of Italy's increasingly privatised healthcare system. The authors compared the effectiveness of public and private sector healthcare delivery in reducing avoidable mortality or deaths that should not occur in the presence of effective medical care. They found that greater spending on public delivery of health services corresponded to faster reductions in avoidable mortality rates. By contrast, spending on private sector services had no significant effect on avoidable deaths, and in fact, a higher percentage of spending on private sector delivery was associated with higher rates of avoidable mortality. In New South Wales, plans for a privately operated and maintained hospital, the Northern Beaches Hospital in Frenchs Forest, is well underway. In an official statement for the Liberals New South Wales Party, member for Manly Mike Beard said last month that partnering with a private or not-for-profit hospital operator will allow the hospital to be built faster, delivering better value for the taxpayers of New South Wales. Alice is a registered nurse with over 13 years' experience in both the public sector and private sector hospitals and aged care services. She wishes to remain anonymous, but had this to say about the government's plans at increasing private or NGO participation in community service delivery.
I feel that this is the wrong thing to do. We're going in the wrong direction. Everything is getting privatised. But the best solution is for things to be public, for services to be public, including hospitals and aged care services.
Alice believes that despite some charity groups, religious organisations and not-for-profit groups being called NGOs, ultimately they are all still businesses.
NGOs are businesses who are there to make money. So they are not going to provide the best services. They're just going to provide services which can make profits for them. And the best way to make profits is to cut conditions and cut wages of the workers and to actually cut positions. So that means that workers end up having to do more work than one worker would usually do. So they're underpaid, stressed, and they can't do the job properly. So of course NGOs don't offer the best services that there are, and the public system is in a position to do so.
Wolfgang Devine is also a registered nurse with over 20 years' experience in the public hospital sector. Here, he talks about the experiences of his colleagues and friends who currently work for private nursing homes and hospitals and the effects of cost-cutting on their work.
Usually you try to save money by delaying employment, by delaying orders or whatever, and that leads of course to more stress for the staff that is left on the ward, or it means that you sometimes don't have exactly what you need and you have to use things that are not quite appropriate, and then in both cases you will see that things get more difficult. If I'm badly staffed, I have to wait for somebody to check drugs with me. Many things that would otherwise flow well take more time, and in the end you feel you have done less, you have done not as good as you could have done, and it's not just that the patient suffers, it is that the whole climate in the hospital, the way how you work with each other suffers under those circumstances.
Dr. Amanda Elliott is a social policy advisor and lecturer at the University of Sydney. She is aware of the effects of a privatised healthcare system on staff and patients, and says that one way to mitigate against the adverse effects of the findings in the Italian study is regulation. But she concedes that this has its own challenges.
Obvious responses, which is regulation. In healthcare it becomes very difficult because it is, particularly for the medical profession, largely independent in terms of standards, and difficult to regulate, increasingly regulate. And certainly within a hospital, the context of hospitals, it's difficult to regulate the standards of care that are in operation.
Dr. Elliott says that there is a myth that private health services deliver better outcomes and care for patients, and her analysis corresponds to the findings of the Italian research.
In the private system, or a system that is based on profitability, people are more likely, for instance, to be released from hospital early rather than to receive ongoing care in hospital. We find that interventions are more likely to happen if there's money to be made from it, and every medical intervention, particularly surgical interventions, bring with it the risk of disability or death. Right? It might be a very low risk, but the chances of that happening, or the numbers of people that will happen to, will increase if there are more interventions. What you get is a different logic at work in public and private systems, and fully privatised systems are much more likely to provide lower standards of care than either a mixed system or a fully public system.
In the coming years, the O'Farrell government is planning to close Manly Hospital in the state's North Shore and to open instead the privately constructed and maintained Northern Beaches Hospital, a transition for the community from a public hospital system to a private one. What this means for the sick and elderly community in New South Wales is unknown, but according to the latest research, it could mean more preventable deaths in care. The Northern Beaches Hospital is set to open in 2018.